Good afternoon, everyone. Bill Rentschler in the 1011 Now Stream Studio joining you again. It is Friday, and that means we have, again, our Friday segment, Inside the Story with the Flatwater Free Press. Again, a story or a segment that we kind of talk with someone from the Flatwater Free Press about some of the work that they're doing. And again, as the name kind of suggests, we kind of go inside the story, get some more details on that story. And today, we are happy to have, again, a new guest on the program, Ryan Hoffman, managing editor with the Flatwater Free Press. Ryan, how are you doing today? How's your Friday shaping up? How's the week been?
It's been good, Bill. I'm happy to be here with you, and yeah, we made it. The weekend's in sight.
We did it. We are so close, and today it has been it's been a little bit of a day today. So happy to kind of have this conversation with you because this is kind of signifying that I'm almost at the end of my day today.
This is the last thing on my list. It's I'm home free after this. So.
All right, awesome. Then we'll go ahead and we'll jump in. An important story today. Again, it's not necessarily an investigative piece, which, again, we see a lot from the Flatwater Free Press. But an important story today. I can go ahead and I can pull it up here so we can see it. Can you kind of break us down? You didn't write this piece, but again, as the managing editor, you kind of know what's going on here. But it's a piece about kind of Nebraskans losing Medicaid coverage and it sounds like a lot of the time it's just because the paperwork's not getting done on time.
Yeah, that's exactly right. And this is really something that's transpiring because of the COVID-19 pandemic. Early on, Congress basically passed an incentive that said, hey, states, we'll give you more money if you stop conducting these eligibility reviews and kicking people off the Medicaid rolls. So it essentially barred states from removing people, which is a normal part of the process. The state regularly checks in, make sure that these folks still qualify for this benefit. It is really aimed at lower income Nebraskans, disabled Nebraskans, and the like. And it's a federal state program. Money comes from both of those entities. And so, over the past 3 years, the state wasn't removing anyone, but it was still adding people. And so you had this large growth in the number of people on Medicaid. And so with the expiration of the federal program, states across the country, including Nebraska, are beginning to restart those eligibility reviews. And this was something that we all saw coming. And, we were expected to see tens of thousands, I believe anywhere from 40 to 80,000 people removed because they no longer qualify for one reason or another. But we're seeing here, and other states are seeing this as well, a whole host of people who are losing coverage who may qualify, but they didn't complete the paperwork on time, or they completed it incorrectly. Or issues like that, what are broadly referred to as procedural reasons, and these procedural reasons are basically leading thousands of people to be kicked off of the Medicaid rules and lose their health care, essentially their health insurance. So it is a massive issue. It's the state figures peg, I think so far around 17,000 people have been removed from the Medicaid rules. Half of those are for these procedural issues such as paperwork problems. So it's a massive issue, and it's one that has ramifications for a whole bunch of interest groups.
Yeah, it's right off the bat. Which again, I should also again say, this story again obviously is posted on the Flatwater Free Press website, flatwaterfreepress.org. So again, you can go there to read it. It's also posted on 1011now.com, so you can read it there. But again, it's the very first line in the story. It's since April, 17,000 Nebraskans have lost their health care coverage, provided by the state's Medicaid program. And again, in the article, and you mentioned it, but with the the federal money with COVID and everything. The state's Medicaid expansion went from about 250,000 in February of 2020 to almost 400,000 this February. So again, almost doubling the Medicaid rolls. And again, now we're seeing a lot of those people, as these eligibility requirements or reviews kick in, losing that. and some of them again purely because maybe they didn't update their address, and now you have no way to get in touch with it. So it could be a really big problem for a lot of people.
Yeah, and it's not like, I'm sure anyone who's had the pleasure of interacting with the federal government, forms aren't, they can be a little complicated to understand, as some of these advocates pointed out, and they have documented a few issues of, what they refer to as hiccups, but paperwork coming in multiple languages, or a person getting a notice one day saying, you still qualify, and then the next day you no longer qualify. So there's been some confusion. The state says those sorts of instances have been rare, but it is not an easy process under the best of circumstances. And so, in theory, who's this program geared toward? It's the poor, it's disabled, it's people who are caretakers. So it's people who are already experiencing, difficult circumstances in life. This paperwork isn't easy to understand, and then, as some of them aren't completing it correctly, or, maybe don't understand it, or whatever the reason is, then they're losing their health insurance, which, is another burden on them.
Yeah, and Dan Golden, who wrote the story, again, he reached out to a number of people in here. One of the people that he spoke with was Jeremy Norquist, who's the president of the Nebraska Hospital Association. And he says, one of the big things they're just trying to focus on right now is kind of what we're doing right now with this segment, is just kind of getting the word out to people of like, hey, if you are on Medicaid, these eligibility reviews have started back up again. You need to make sure your address is current. You need to make sure we can get a hold of you.
Right. Because this has a direct effect on the hospitals in the state. I mean, I think it's anywhere from 60 to 80% of the total hospital revenue comes from these government programs like Medicaid or Medicare, which is the insurance program for people 65 and older. So they if someone loses coverage needlessly and they still, have a health emergency and show up at a hospital, they're not going to deny that person care. The hospital's not. So then that becomes, what's referred to sometimes as charity care, and it's basically, the hospital eats the expense. So, they have a stake in making sure that, people who still qualify don't lose that coverage. And yeah, they acknowledge that, advocates and the state is doing a lot to try and get the word out, but they're watching it closely to make sure that people are aware. And like you said, that's the big consistent message from folks is, make sure the state knows how to find you, make sure your information is updated. And that's really, as far as a uniform message from all the various people, working on this issue, that seems to be it. Make sure the state knows how to find you.
And so, again, for people who may see this, may themselves be on Medicaid, may have friends or family members, best way to make sure everything's all up to date, I'm, guessing is probably just reach out to the state, reach out to the folks who are in charge of this program, and make sure everything's all squared away.
Yeah, absolutely. And there's an online portal that a lot of people who are currently on Medicaid can go to make sure that everything's in line there. They can contact the state directly. There's various advocacy groups, Nebraska Appleseed, the Health Center Association of Nebraska. They all have advocates and people working to help on this issue. We have in the story a brief snippet of information with links to various resources. It's just critically important that folks who are on Medicaid make sure that all their information is up to date, so that they don't needlessly lose their health insurance.
And I mean, there's literally nothing worse than needing that, trying to go to the hospital or go to the doctor and all of a sudden finding out I'm not covered anymore because, I got kicked off the rolls or whatever it might be. So, again, a super important story, Ryan. Again, thank you guys again for doing it. Again, Dan did a good job putting this together and to a number of people. So, again, you can read this story on the Flatwater Free Press's website, which, again, is flatwaterfreepress.org. This is also living currently on the 1011 website as well. So, anything that we missed, Ryan, that you want to make sure that we kind of get covered before we let you go?
No, is an important issue. It has an impact on hospitals' bottom lines. It has an impact on all of us. Whether or not your neighbors are healthy. You may not think it matters, but it really does. And one thing that we didn't talk about is half of the people on Medicaid are children. So some of the most vulnerable people in our society. It just is a critically important issue. I appreciate you guys bringing some added attention to it, and appreciate you having me on today.
Awesome. All right. Well, I appreciate you, Ryan, for jumping on, and you go ahead and have a good weekend, all right?
All right. You do the same.
All right, that was, again, Ryan Hoffman, managing editor with the Flatwater Free Press Show. Appreciate him jumping on to talk to us today. Again, as always, we try and do this segment every Friday at right around 2 o'clock. Again, sometimes it's a little later, but every Friday right around 2 o'clock. And again, we'll be back again next Friday with another segment of Inside the Story. So again, thanks everyone for tuning in. As always, please keep it tuned to 1011, both on air and online, for all the latest news, weather, and sports. Hope everyone has a nice Friday afternoon.